Welcome to Health and Wealth. We're your hosts, Tyler and Kelly, and we're glad that you're joining us on our last episode of Health and Wealth for now.
Last episode, what do you mean?
Well, Tyler, if you didn't hear, I'm moving to San Francisco, California. I may be back, so we may be able to start this back up, but for now, Tyler and Kelly Health and Wealth will be no more.
Whew, I sure hope it's not long.
Yeah, me too. So today's guests, we have two very special ones. First and foremost, we have Divya Ramachandra talking about genetic counseling. And then after that, we have Amanda Lee talking about entrepreneurship and business owning in the Twin Cities market. Right, Tyler?
That's right. She'll be talking about growing her real estate development team.
Interesting. Kind of a piggyback off of some of our other topics, which is all the better.
Divya, thanks for joining us today.
Thank you, Tyler.
So you're going to talk about genetic counseling. Can you give us a little history on the practice and how it's developed throughout the years?
Yeah, so genetic counseling started when scientists became more aware that medical conditions could be inherited, that they could maybe figure out risks beforehand. And they saw a need for there to be a profession where people were able to explain what these genetic conditions were, and also deal with the psychosocial component of talking about these. So it actually started out in New York City, that Sarah Lawrence was the first training program. And from there it spread all across the East Coast and then across the rest of the nation. And it started off mainly with prenatal counseling. So predominantly that's where genetic counselors were. But as, for example, cancer genetics has become a bigger topic, and there's more known about that, that's become a big field that genetic counselors are in now. Pediatrics, specialty diseases, and then a growing field has become laboratory genetic counseling. So genetic counselors are actually working in the labs and helping interpret whatever genetic changes they find. So that's kind of where the profession is today.
So it sounds pretty interdisciplinary. Is that a fair assessment?
Yeah, I like to say it's like the crossroads between the hard science of genetics and then the psychosocial counseling.
Okay. So just in terms of your own personal development, what do you feel like you bring? What are your strengths when you're working with patients?
I think I've always been comfortable talking with people, and that's a big skill to have when you walk into a room, and also being able to read people is a big skill that genetic counselors need to have, because when we walk in, we get a patient file and we see their medical history. So we know where they are at a medical level for the most part, but when we walk in is when we figure out, okay, how much genetic information do they already know? How much genetic information do they want to know? What are the family dynamics? Who are the big players, you could say, decision makers in the room? And so you have to, and something I've been good at is kind of reading people and asking more questions to figure out what or how to tailor the session to that family or to that individual.
Mm-hmm. Okay. So you're working with families, with individuals. Who's an ideal candidate who would consider genetic counseling?
So the broad description I would say for patients would be people who are at risk for having a genetic condition, meaning that there's something in their family history that concerns them, or somebody who is experiencing a set of medical symptoms that people think are related to a genetic condition. And so a lot of the times, the majority of our conversation is talking about genetic testing. So if somebody has been told by a physician or told by somebody else that they should pursue it, then genetic counseling is definitely something they should seek.
So you're seeing patients before the testing and then afterwards for the counseling, or what's the chronology like of that process?
Yeah, so it depends on the clinics. Genetic counseling is still a growing profession, and not everybody knows what a genetic counselor is. But typically, or ideally, we would be there for the pre-test counseling. So that means we'd be talking a little bit about what the condition is or what we're looking for, and really going over the informed consent of testing. So
being like the benefits and risks. Okay.
Exactly, and what implications they could have and what we could find. And then if the patient decides to go through testing, then ideally we would be there for post-test counseling as well, especially if they do find something that's concerning.
Okay. So give us like a rough example, one that you can, maybe a story you can tell about, without getting into too much detail about what that process is like. Just kind of like walk us through an example of a genetic counseling patient.
Yeah, so I could say, like, for example, in pediatrics, sometimes we see children who maybe they were, born naturally and they looked fine and things were fine, but slowly they started to have like developmental problems. So maybe they weren't walking on time, talking on time, and then other things start to happen, like there's maybe some physical abnormalities or learning difficulties, and they've gone through a lot of doctors, and we call that a diagnostic odyssey. They've just been through a lot of different tests, and so when they come to us, we take their family history and we look to see if anybody else in the family has had similar issues or kind of things that we shouldn't normally see in a family history. And from there we would either do like some specific genetic tests based on what they're showing, or we kind of look at the DNA as a whole.
Okay. And then once that happens, is it kind of off your hands as a genetic counselor, like you've done pretty much what you can, or will patients return to you once they've maybe had that testing done?
Yeah, so ideally they would return to us, especially sometimes if we don't find anything, like we call it a negative test result.
Okay.
Just with the technology we have, or the genes we were looking at, we don't find anything, we might call them, but typically they'll come in and we will go over what we did, because testing can take weeks to months. So we go over like what the testing was, and then what their test results were, and what implications it has for them. And then a lot of times we help them with the next steps. So sometimes based on the profession, you might see a family or a patient once and then never really see them again. And sometimes you actually will see them throughout their childhood, adulthood, through multiple pregnancies. So it really depends on what specialty you're in and where you're at.
Okay. So are you ever like making referrals after you see them? You were talking about the next steps. Is that part of the process of genetic counseling, is pushing them along in certain directions depending on what you feel is appropriate?
Yeah. So for example, in cancer, if we have individuals who come back with a positive test result in some kind of gene. So for example, if in like a BRCA gene, which is puts them at a higher risk for breast and ovarian cancer and some other cancers, then the follow-up would be increased screening, possibly surgeries. And so we don't specifically take care of that, but we might refer them to like an oncologist or a surgeon or like a nurse coordinator that will help them set up those screening appointments. So that is our job, referrals.
Okay. Controversial question here. What are your thoughts on some of the in-home testing products out there, 23andMe or similar services that people can kind of, map their DNA a little bit, find out some susceptibilities? Do you feel like that's kind of the future of genetic testing, or what are your thoughts?
Yeah, so direct-to-consumer testing is definitely a hot topic with genetic counselors. And our biggest concern is that the evidence they use for saying, oh, you're at higher risk, is maybe not as peer-edited or reviewed as what we would use to say that, or what a laboratory would use to interpret that genetic change. And so that's why there was a lot of controversy in terms of like these companies saying whether you're at a higher risk for cancer. That's such a big medical condition that has a lot of implications. So for, people falter on this, or kind of genetic counselors differ person to person. For me personally, I think it's happening. I don't think we're going to stop it. So I think the future is us becoming involved. So actually some of these companies do have genetic counselors that you can call and talk to about these results. And I think that's a really good step forward. I also think that there's just more education that, these test results maybe you want to see a doctor, but really you should take it with a grain of salt sometimes. And whatever these companies decide to test for, they should also be careful in what they're saying. Yeah.
Do you see that as a way that the field of genetic counseling might grow, or do you feel like it's going to keep growing regardless as people are more interested in discovering these genetic predispositions?
I think it'll grow regardless because there is a limitation on what direct-to-consumer companies will test for, and because there are so many conditions that require a risk assessment, so us looking at their family history and really being able to tell them what's happening. So, I know there's sometimes a worry that direct-to-consumer testing will take out our profession or something like that. But you still need somebody to explain these things, and that's really a lot of what we're here for, is that education aspect. And no matter how many pamphlets you read or videos you watch, it's much more beneficial to come in to talk to somebody. So I think our role will still be important.
You talked a little bit about the informed consent part of your job. What are some of the risks of doing genetic counseling for patients?
Yeah, so it depends on what tests you're taking, but for example, if you're doing genetic testing on yourself, a lot of times in medicine, it's kind of all about you, so it's just the patient. But with genetics, you share that with your family. So one thing we talk about is that this may have implications for other family members. So this is not just about them, but there's family dynamics to think of. Who else is at risk in the family?
That psychosocial piece you're talking about.
The psychosocial piece, and just we don't want to surprise them. If we find something, we want them to know that this could have implications for your children. And also, depending on the tests we're doing or the variety of tests we're doing, we may find genetic changes that we weren't originally looking for. Or a lot of genes will cause multiple problems. So not just breast cancer, but also colon cancer. And so we make sure to let patients know that this encompasses a broad range of diseases. Not just so they aren't surprised or they know, so there's some patients who don't want to know these things.
Right.
Or for example,
so who determines that then? Is it the patients?
If they do or don't want to take, yeah.
Okay, so you always defer to the patients unless, are there instances where if there is certain family involved or puts others at risk?
I think the only time where we say we might not let somebody do genetic testing is for minors.
Okay.
And that's usually for adult onset disorders. So Huntington's disease is the one that people talk about the most. It's just a practice not to test minors because you don't need to test them that young, and it should be their choice when they turn 18. So that's usually the circumstance in which we would say no.
Okay. Yeah. Have you yourself done any genetic testing of yourself?
For me, no, I haven't. Actually.
You haven't?
No.
Okay. Is there any interest that you have in that? Or do you want to be one of those people that doesn't want to know?
Well, I think, since there isn't something specifically that I need to look at, I wouldn't get it done. I know some of my classmates have done direct-to-consumer testing.
Okay.
But I just wasn't interested in the information they could give me.
Okay.
So, but if I was at risk for something, I wouldn't be too hesitant about taking a genetic test.
Anything you would recommend for viewers to know if they're considering it?
With genetic testing? I think to keep in mind that this is a family affair, in the essence that this doesn't just affect you, it could affect other family members. So to think about, and the counselors usually kind of go over this with you, to think about, okay, what would you do if you got these genetic test results? Also, I think there's a big myth with genetic counselors that we're here to design babies, and that's not what we're here for. So it's really about the patient and what they want, and we're there to support them regardless of what we really think in our heads. So genetic counseling is kind of different from going to see a physician, who a lot of times physicians give their opinion and might push kind of what they think is the best thing. Genetic counselors usually hold on to this tenet of non-directiveness. So we lay out all the options, and it's always the patient's choice. And I think that's something we really emphasize with patients, that you can choose whether or not to do genetic testing. You coming in and telling us that, or being interested, doesn't mean that we're gonna strap you down and draw your blood.
Right. So it's always the patients who kind of decide.
Yeah.
Okay. Well, great. Thanks so much for joining us, Divya, and giving us a little background on genetic counseling and who could benefit from it.
Thank you. Thank you for having me.
Amanda, thanks so much for joining us.
Thanks for having me.
Can you tell our viewers a little bit about yourself, who you are, what you're doing?
Yeah, so my name is Amanda, and I am a realtor for Keller Williams. And I am a first-generation Vietnamese American. My parents came from Vietnam. And I got into real estate in March of 2015. And before I was doing that, I worked at a nonprofit for 6 years at Rise Incorporated, helping people with a mental health diagnosis obtain employment.
Okay. So how did that transition into real estate occur?
You know, the boyfriend that I'm dating right now was getting his license for real estate and said, you'd be great at real estate. And, you know, everyone wants to get into real estate because how fun would that be to, show people houses. So it was really nerve-wracking to think about going 100% commission when you have a paycheck every week coming in. I have a mortgage, I have a car payment, got student loans. So thinking about that was a little bit terrifying. But he said, you've got what it takes, take the leap of faith, and you'll do an awesome job. And here I am.
Right, yeah, and it seems like you had a pretty good start, right?
Yeah, so I got into real estate and I joined a team, and I sold 18 houses in my first 10 months. In 2016 was my first full year, and I sold 77 homes in my first year. Wow, okay. So that sounds like a pretty good number. What have been your keys to success so far? Well, just the foundations, the fundamentals of it. At Keller Williams, they have wonderful trainings to get new agents get going. Even for long-time veterans, it's good to go back to the fundamentals. So that's like working your sphere, the people that are your friends and family that love and trust you. I do a lot of door knocking. I do open houses. Okay. So yeah. So who are you door knocking when you do that? I usually door knock around my open houses, listings that I just put on the market. I'm door knocking neighborhoods that my buyers aren't finding homes in. So Bloomington's a very hot area. So people are like, I want to live in Bloomington. There's nothing available. So then I go out and look for them. Okay. So what were your expectations going into real estate, and kind of what's the reality now? Is it pretty much line up, or are there things, preconceptions you had? I don't know what I was expecting when I got into real estate. When we are in school, they tell you that average agents sell 6 to 7 houses a year. And so when I joined Keller Williams, I heard that the rookie of the year sold 68 houses in her first year. So then once I saw that, and she's from South Dakota, I'm thinking, well, I think I can do a little bit more than that in Minneapolis. So 77 in my rookie year, I got Rookie of the Region, which is a 6-state region. Yeah, congratulations. That's amazing. Okay, so from there, you've gone and you've started kind of your own team, right? Yeah, so starting 2017, I've added 4 people to my team. I have a virtual assistant. Well, I think I have more than that. Virtual assistant, an admin, 3 buyer agents, and an inside sales agent.
Okay. What's been the process for starting your own team? That sounds like a pretty massive undertaking. Is it as hard as it sounds, or
at Keller Williams, they really tell you how to leverage, and usually somebody can do up to 30 transactions for one person. Then you're going to have to start doing hires if you want to help people. And my goal is to help 150 families buy homes this year. So I can't do that myself, and that's why I have a team to help me.
Okay. What do you expect from your team as a leader?
I want people that are here ready to learn and want to help more families get into homes. It's already hard enough to hold myself accountable, let alone hold everybody else accountable. So if they have a can-do attitude and want to work hard, then I can't deny good talent.
Sure. Okay. This is a little bit of a loaded question, I'm sure, but what are your thoughts on the real estate market right now for the Twin Cities nationwide? Do you think we're healthy? Do you think we have room to grow? Are we in a place like 2007 where maybe we're starting to hit a bubble? What are your thoughts?
I think we have a very healthy market. Right now interest rates are around the 4%, and if you look at historical records, they're usually about 6 to 8%, and that's why home ownership is such a big thing right now, is that you can get into homes for less than what you're renting for. And so, yes, the house prices are going up, but it's because a lot of people are getting into homes. For housing bubble, I don't think that's the case here, because to get approved for a home, you have to do a credit check, an employment verification. You have to show that you have stable income. So the people that are getting into homes are people that are working hard to be in homes.
Okay. What's preventing people from getting into homes, do you think?
Just not enough resources, not knowing how attainable it is. And that's kind of my niche, is working with first-time home buyers in communities that are, underserved, like minorities. A lot of my friends are from, Africa or from Asia, and they are first generations here, where their parents haven't owned a home, and they just don't know where to go and what that looks like. And so for me, when I'm helping my friends get into homes, I put it on Facebook, and then everyone else sees it, and they're like, well, if they can get a home, I can get into a home. And it just kind of goes like wildfire.
Okay. So you mentioned your previous kind of career trajectory was working more in the nonprofit side, right? So how did that skill set help you transition into real estate, or what you're doing in real estate?
Sure. So helping people get employment is very similar to real estate, actually. I'm getting them ready for interviews. I'm putting their resume together, sharpening their skills on how to get that job. And even in real estate, one biggest thing is income and employment. So I've helped people get raises at their jobs, fix their resumes to apply for a better job. So it's always thinking on your toes and trying to do whatever it takes to help people get into homes and build net worth.
Yeah, it almost sounds a little bit like kind of a social work approach to real estate. Would that be kind of a fair assessment?
They always joke about what real estate agents' job descriptions are. They always joke that we're people's counselors, therapists, and a lot of it goes into it, because there's so much that goes into buying a home. Identifying their needs, how many people are in their family, making sure that it's within their budget so that they can be successful in home ownership.
That sounds kind of overwhelming.
I love it. It's my big why, helping people get into homes and building their net worth. It's something that I can make a big impact into the community. So I'm working 12 hours a day, 7 days a week, and it pays off. It feels good.
So is there a work-life balance, or is work kind of life right now?
It's funny that you asked that. So my boyfriend's a realtor, so at home it's about real estate, at work it's about real estate. The functions that I go to, it's either a housewarming party because they just bought a house, or someone's expanding their family by having a baby shower. So those are my functions now.
Okay, but you enjoy it, so
I love it.
Maybe it doesn't feel like work in that regard?
No, it doesn't. It doesn't feel like work. When you are passionate about something, you don't have to force yourself to do it. You enjoy doing it, so it's no longer work.
Sure. How would you alleviate any hesitations people might have about getting into the real estate market as a buyer? Because it's a big step, right? And I'm sure you've dealt with people who are kind of, deciding whether it's right for them.
Sure, I say that if you're working hard and you're paying, rent, these days rent is a ridiculous pricing now. You can't even get into a rental for less than $1,200, or it's usually from 12 to 14, even more than that. And so if that's what they're currently paying right now, then they're ready to buy a house, because that's what you can get into a home for. And when people are like, well, I don't have a down payment, they don't even realize that you can get in with as little as a 3.5% down. So by the time you save first month's rent, last month's rent, and a security deposit, you're halfway there to a down payment. And then there's down payment assistance programs that they could be eligible for that they don't even know about.
So a lot of it is just kind of providing people with that information that they would have no idea about, to kind of get them thinking in the right direction.
Yeah, and then a lot of concerns for people is credit. And, they don't teach you enough about it in school. And so people get pretty embarrassed about, I don't have the greatest credit. And we're here to help them rebuild their credit and, get a secured credit card or start learning how to save and budget, and so that they can get into a home.
Okay. Anything else you'd like to add about you or what you're doing, where you'd like to grow your business, where people can find you? If you're looking for more people, it seems like you probably have your hands full.
So we have an office in Northeast Minneapolis, not too far from here, off of Central and Lowry. So if you ever want to come and learn a little bit more about real estate or get into homes, we are located on 1033 Lowry Avenue Northeast. If you want to get into real estate, there's a lot of intro classes to learn a little bit more before taking that dive in, because it's a big, step to get into real estate. People think it's a lot easier than it really is, and so it's good to get some of that information up ahead of time.
Okay.
Yeah.
Great. Well, thanks so much for joining us, Amanda. That was a wonderful overview of what you're doing, the real estate market. Really appreciate having you on.
Well, I'm honored to be here. Thank you.
Thanks.